Hello, this is Glenn's Musings, and usually I do Baha'i topics, but today I'm going to do something that I think we could all would be a useful thing to know. I was a nurse for about 10 to 12 years, and this is going to be a little bit weird, but I'm going to tell you some secrets that I think might save some of them might save your life. And the first and foremost thing is if you've got a special condition and the doctor has special orders for you, just ignore me. Go with your doctor. I'm going to say that a lot. Go with your doctor. So, we all poop. Pooping is fine. But if you look at the color of your poop, if it's black, go to the hospital. That's bleeding internally. You can bleed a lot that way. Go to the hospital. That's not a that's not a bleeding you want to ignore. You can bleed a lot through the gut. You want your poop to be just kind of the same consistency, just nice and soft and brownish. If it's a different color, one of the more common causes of a different color, believe it or not, is food coloring. You eat too much food coloring, sometimes it'll color down there. There are some other colors, but some of them are signs of infection, some of them are malnutrition. So next time you see your doctor, ask them about that color. They might have something to say. The only color I want you to really be aware of is black. Even blood in the toilet is less bad than black poop. What it is your body digests the blood and it turns it into that black color. Okay, now we're gonna go with the other end. Peen. You want your color to pretty well be yellow. If you get super clear, that can be a sign that you're drinking a little too much water, but you can almost never drink too much water, so I'm more concerned if it's brown. If your urine is brown, that means you're not drinking enough. And that's a much more common problem than people drinking too much. Mostly, you just listen to your thirst. Your body will tell you when it needs a drink, and that's your thirst mechanisms. Blood there, you need to be seen. It's not an emergency, but you need to be seen. So you could go to you don't need to call for an ambulance. Now, bleeding anywhere, if it's so extensive that you're starting to get lightheaded, dial 911. I don't care where the blood's coming from. If you're becoming lightheaded, that means you're not having enough blood for your brain. Dial 911. Don't drive. You really should not drive if you're starting to feel lightheaded. Let someone else drive you to the hospital if you don't feel comfortable dialing 911. Then, one other thing, this is more for ladies and men. We always hear about the left arm and chest pain, sometimes confused with stomach pain, but it's a sudden onset of just really very painful. And you'll probably be sweaty and like almost like having to breathe really deep because you're trying to oxygenate your tissue, but because the heart's having trouble, it's not pumping very well, and that would be a heart attack. But now, for the ladies, your heart attacks aren't as classic as men's are. I've taken care of many a woman in which it was just their jaw hurting. I've had one male, but it's more the women where just their jaw was hurting. I've had like 3 or 4 women who was their jaw hurting and they were having a heart attack, and I've had maybe one guy. So the big key thing is it's a sudden pain. I don't care where that sudden pain is. If you have a sudden spiking pain, that could be an appendix bursting, that could be a heart attack, that could be almost anything. If you have a sudden just snap, it's there, and it's a single point of pain, go to the hospital. I'm serious. My brother, he got black poop because after dental work, his tooth sort of left open and was bleeding from there. And so he was bleeding a lot. That's why I'm saying if you ever have black poo, that's go to the hospital. I wish you the best. And just your body, if your body's telling you something, talk to a doctor. I'm not a doctor. I'm not going to diagnose you. I was the nurse, so I could take care of you. I could recognize certain symptoms and signs. Okay, so I'm going to say a prayer for healing. Praised be thou, Lord. My God, I implore thee, the most great name through which thou didst stir thy servants and unfold bounties, set their faces towards the tabernacle of thy wisdom, healing through the sickness, and have direction of thy manifold bounty. Set thy face towards the tabernacle, healing with the sickness of that sailed thy name, ordained the King of names, all who are in heaven and on earth, art potent art thou to do what thou pleaseth thee. In thy hands, in the empire of names, none other God is there, but thy mighty, thy wise. I am a poor creature, O my Lord. I have clung to the hem of thy riches, and sore to the sickness. I have fasted a cord of healing. Deliver me from ills. Encircle me and wash me of thy sweet waters, and graciously and mercilessly attire me with the remnant of wholeness. Though thy forgivingness and bounty fixeth them their eyes upon thee, and rid them of all attachments except to thyself. Aid me to do what thou desires, and pleasest. Thou art the Lord of this life and of the next. In truth, the ever forgiving, the most merciful. That prayer was revealed by Baha'u'llah. Thank you for staying through to the end of the prayer. Like I said, I'll occasionally on Glenn's Musings do a non-Bahai one, and for the most part, other than the prayer, that was non-Bahai. I hope you have a good life.